there's a lot of misconceptions about what a bulging disc and a herniated disc looks like. And it's really just nomenclature. It's radiology. So essentially, how does it present on film? And to what extent is it injured? A bulging disc, we can see asymptomatic bulging discs in patients. We can see symptomatic bulging discs in patients. That happens quite often, when there's trauma. So like when people get into accidents or have significant falls and they're relatively young and we MRI their spine, they have lots of back pain that seems like it's coming from the disc, or at least that's how it presents, and they have bulging discs. It's really easy to understand that may be a new issue and it's symptomatic. But for the most part, a bulging disc, in my opinion, from a chronic perspective, is the beginning stages of the degenerative process. The disc is losing its structural integrity. Maybe there's some stress-strain relationships that are causing it to bulge. But when we get to the point where there's an actual herniation, what that represents is damage to the actual ligament, and now the jelly inside is starting to migrate or move towards the outside. And it's very pinpoint or isolated. We call them protrusions, and you can see them very clearly on film. Now, in the worst case scenario, that protrusion would be irritating a nerve root, and we'd have neurological complications in the form of arm or leg pain. Obviously, we don't want those, but at the end of the day, they do present pretty often, right? Now, even in those circumstances, when we have disc herniations, the proper course of care is not just go in and start cutting things out or go in and trying to heal them. It's always conservative care first. If they do well there, then we can kind of progress them along.